you specifically with this breakthrough study that you published back in August of 2023, you created some pretty amazing, compelling results there. So could you take us through a little bit of that and
Yeah, sure.
yeah, explain your results and how you got to those results?
Yeah, absolutely. So maybe I'll start like the science, just to put it into context. I That was the second paper, and I basically confirmed what Dr. Bredesen had found in
Yeah.
our research. So in 2022, we were doing these concurrently. Dr. Dean Ornish was also doing this all in the time of COVID.
Yeah.
So we all started our research around 2019 or so, and we're recruiting for trials. So Dr. Bredesen's group, they had 25 participants in a 9-month intervention using Dr. Bredesen's protocol, which is what I used as well. And they took participants with MoCA scores down to 19. So they published in the Journal of Alzheimer's Disease as well in July of 2022, and they showed that 84% of their participants improved their cognitive function. And then a year later in 2023, in August, we published our results also in the Journal of Alzheimer's Disease. And we had 23 participants who we took through a 6-month intervention. So not quite as long, not the 9 months, but 6 months, we were looking for a quicker result because that's what I had seen clinically.
Yeah.
And we took participants who had MoCA scores between 12 and 23. So the MoCA score is the Montreal Cognitive Assessment.
Yeah.
And this is a blunt instrument. It's a way to put a number on where someone is in the spectrum of cognitive decline. And Dr. Bredesen's group took participants with MoCA scores down to 19. 26 and above is normal. Once you start getting below 24, this is starting to affect people. They're noticing, or their loved ones are noticing. And down to 19, this is definitely mild cognitive impairment in that zone.
Yeah.
And we were taking patients, we did not exclude people who had a diagnosis of Alzheimer's. We included people with much more progressed disease down to 12. And then we didn't take anyone with normal cognition on a MoCA. So they had to have below a 23 or 23 or below. And what we saw, as you might expect, is that 74% of our patients improved. So it wasn't the 84% for with a longer intervention, less cognitive impairment. 84% of the time. So this is consistent with what we see clinically. The earlier we get involved, the earlier we can start this approach, the younger someone is, the better and quicker the outcomes.
Oh, yeah.
And the more confidence we have, the later stages, it's harder. It takes more effort. It takes more time. We know that dementia, the changes in the brain start decades before those early symptoms. And so there are these 4 stages that Dr. Bredesen describes. The first is that pre-symptomatic phase where the changes that our brain is in that attack and defend mode. We're already starting to accumulate potentially amyloid or tau or there's neurodegeneration happening, but we're not aware of it. We cope with it.
Yeah.
And then the second stage is the subjective cognitive impairment, where we're aware, but it might not get measured on these instruments. It might not be measurable yet. The third stage is measurable cognitive impairment or mild cognitive impairment. And there's nothing mild about this stage, right? People are losing their jobs. They're not able to drive anymore. They are not able to feed themselves sometimes or cook or do complex tasks. But they might still be able to get dressed and do some things independently throughout the day, but not at the level that they used to be.
Yeah.
And then the fourth stage is actually a very late stage. This is diagnosed Alzheimer's, where people really are losing their dignity, their ability to live independently. And if we can intervene earlier on, if we can prevent, delay, we have so much more confidence.
Yeah.
So, but we also see that people, even at very late stages, they've surprised me and taught
Yeah.
me that it is possible to see improvement.
Yeah. Yeah.
So hopefully that's helpful. But
Yeah,
and
no,
then
that's
also
great.
the study. So
Yeah.
just in 2024,
Yeah.
there have been, in June of 2024, we saw Dr. Dean Ornish's
Yeah.
paper was published,
Yeah.
and it was the first randomized controlled trial
Yeah.
that showed the difference in a lifestyle intervention for compared to control. There were 49 people in their study, and they showed a statistically significant improvement in cognition for people with early Alzheimer's disease and mild cognitive impairment. So now there's a controlled trial, and they did that in just 5 months.
Yeah. Yeah.
So even quicker.
It's amazing. It's amazing.
Yeah,
Yeah, no,
really
this
fun.
this approach that you guys have been implementing, um, it the research papers that keep coming out just shows that this really, as you guys iterate and you optimize it, it is becoming really what the standard's going to be going
I
forward.
hope so.
Yeah, absolutely. I hope so too. But I've got a lot of confidence and faith in you guys. You're doing great work. Um, you have these pillars that you use, these very systemized central pillars to how you help patients recover memory, recover cognitive function, increase those MoCA scores. Can you kind of go into those pillars?
Yeah, so at Marama, I often speak about these pillars, and this is the lifestyle. This is, I think of the lifestyle piece is the bulk of this. Everything else is icing on the cake, right? Like, but the cake itself,
Yeah.
and keto cake, of course, is these lifestyle pillars. We can, if we pull these levers, and I don't even recommend getting any expensive testing done until you are pulling these levers. Don't worry about, all of I mean, it's so painful to say that. I don't mean don't worry about it. If you can't, if you
Yeah.
feel financially constrained, focus on these four things. So the
Yeah.
four pillars I think of are diet, an
Yeah.
organic ketogenic diet. If you do nothing else, do that. Get
Yeah.
into ketosis, get that metabolic flexibility. Nobody needs to be in ketosis forever, but a
Mhm.
sustained keto diet for 3 to 6 months for anyone suffering with cognitive impairment. There's a healing process that takes place.
Yeah.
And just getting the carbohydrates, especially the highly processed carbohydrates out of the diet,
Yeah.
that is a detox process. But getting metabolically into ketosis, it's detoxifying, it supports mitochondrial function, it supports the generation of enough resource, of enough energy for the brain. It also is so it's detoxifying, it's less creates less oxidative stress. One of the hallmarks of aging, we reduce that oxidative stress when we're in ketosis rather than glycolysis. There's a huge number of benefits for getting into the ketogenic diet, into metabolic ketosis. And
Yeah.
then over time, what we want to do is go back and forth. Life happens, go to Italy, eat the pasta, like whatever. But when you come back, get back into ketosis.
Yeah.
And then when you come out of ketosis, I highly recommend Mediterranean diet or a paleo diet or even maybe a plant-based diet.
Yeah.
So always organic and always minimizing as much as you possibly can processed foods.
Yeah.
So that is pillar one, is diet.
Yeah.
The second pillar that we talk about in at Marama is activities. And this is like, what do we do when we're not eating during the day, right?
Yeah.
It's the exercise. So it's physical activity, but it's also cognitive activity, cognitive engagement. It's social engagement, it's purpose, it's meaning. It's like, what are we spending our days doing?
Yeah.
And this is an invitation to be like, okay, if my priority is my brain health or my loved one's brain health, how do we spend our day? Do we spend it sitting in front of the TV? Do we spend it vegging out, not really doing much? Or are we engaged in music and in maybe playing cards or dancing or getting going for a walk? Are we meeting up with our friends? Are we putting effort into the things that are going to support our brain health? Are we having fun? Are we finding joy?
Yeah.
Because if there's no reason to live, or to like, if we don't have any motivation and nothing to live for, it's going
Yeah.
to be hard
Yeah.
to engage in these things. It's going to be hard. Why do we need to remember if we're not having a good time?
Yeah. Absolutely.
So those activities, building them, investing the time in them, investing the effort in them, and understanding, for this particular person, like for one person, it's going to be pickleball, which is amazing, right? Hand-eye coordination, social engagement. Often people are outside, you're getting the physical exercise, there's strategy involved. Racket sports are amazing. Ballroom dancing, amazing for brain health. Um, but that's not for everyone,
Yeah.
right? And so what is it for and what are the interests? And there's a wide spectrum, and this is very individualized. But
Mhm.
how can I think of channeling my inner Betty White. How can we imagine a life that just
Yeah.
gets better and better and better as we age?
Yeah.
And this comes out of Becca Levy's work. She's at Yale. She wrote a book called Breaking the Age Code. And it's about, essentially, she published the research that shows that optimists lived about 7.5 years longer.
Yeah.
And also that if we have these ApoE4 genetics, that we can actually eliminate the risk associated if we imagine that there's lots to live for, that life is just going
Wow.
to get better.